change, health, and small island states. We will start in a few minutes while we wait for everybody to enter this webinar. And until then, please feel free to write your name and where you're from and your institution in the chat so we get to know each other a bit. And we will wait 2 or 3 more minutes until we begin. So good morning or good afternoon, everybody, and welcome to the webinar Climate Change, Health and Small Island States. My name is Wandini Lutschman. I am a medical doctor and a master's student in international health at the LMU in Munich, and I will be chairing this session today. So as you all know, climate change poses one of the biggest threats to human health, whether it is from the direct effects of changing temperatures or natural disasters or the indirect impacts on agriculture and water. We are all currently experiencing the health effects of climate change. While small island states contribute a negligible amount to greenhouse gas emissions worldwide, they face the most severe and persistent consequences of the changing climate. Today, we will be joined by 3 experts from the Philippines, Mauritius, and the Pacific Islands, who will be discussing different specific challenges faced by these islands and strategies which we can use to build climate resilience. So let's get started. Before we begin, I'd like to quickly introduce the One Health Knowledge Cafe, which is the main organizer of this event today. The One Health Knowledge Cafe is a project by the Center for International Health in Munich and is the collaborative effort of more than 11 individuals representing the CIH partners and alumni. And since July 2020, the One Health Knowledge Cafe has been holding monthly talks, webinars, online courses, and discussions, all within the umbrella of One Health. As a reminder to you all, I would like to ask you to please keep your cameras switched off during the sessions and your microphones muted unless you're a presenter. This session is being recorded and the video will be posted on the Center for International Health website, as well as the slides from the presenters. As for the agenda for today, we will have 3 20-minute presentations followed by a 5-minute Q&A session. Please, I highly encourage you to send all your questions via the chat today and write down your institution if you belong to one and where you're from as well when writing your question. So I think we can begin with the first presentation. Okay, so our first presenter is Dr. Colin Tukutonga. Colin is the inaugural Associate Dean and Associate Professor of Public Health at the Faculty of Medical and Health Sciences at the University of Auckland in New Zealand. He is a public health medicine specialist with extensive experience in leadership, management, public research, and public health in New Zealand, the Pacific region, and also internationally. Colin was also the Director General of the Pacific Community for 7 years, up until December 2019. Thank you so much, Colin, for being here today. And I'm really looking forward to your presentation, as we all are, and please feel free to share your screen.
Well, thank you, Wandini, and good morning. It's 1:30-ish in the morning here, so you'll forgive me if I'm a bit sluggish, but it's a very, it's a joy and a pleasure for me to join you all. I want to thank Wandini and the team for inviting me. What I thought I would do in the short time that I have is to just share with you a little background about the Pacific issues, particularly in relation to, I've actually taken to calling it the climate crisis as opposed to climate change, and talk more specifically about the health impacts of the climate crisis. Wandini, can I just check that I'm coming across okay?
Yeah, we can hear you perfectly.
Thank you. I mean, obviously the Pacific Ocean is a huge, big blue sea. The important point in this here is that 80% of the protein source for Pacific people come from the sea. That significance of that we'll discuss a little later. The main thing, of course, now is that people in the Pacific have looked after this big ocean for centuries. But in more recent times, it's under threat from pollution, from overfishing, unregulated fishing, climate change, environmental degradation, and habitat destruction. These are, of course, very small populations scattered across the Pacific Ocean. It's a region of contrast, not particularly economically strong. There are significant issues of education, skills, and income. And one of the things I'll talk a lot more about later on is water. Access to clean water is a major, major problem in our part of the world. And the climate crisis will have a big impact on access to clean water. Without a doubt, the climate crisis is the most important threat to the lives and livelihoods of people in the Pacific Islands. And they're a bit, they feel aggrieved that whilst they contribute less than 0.03% of the harmful greenhouse gases, the small islands of the Pacific are already experiencing significant negative impacts of the climate crisis. And many of them, some of the communities have had to be relocated further up away from the coast and enforced migration. One of the key things I want to stress is that the problem in the small islands of the Pacific is that the infrastructure, access to water, access to health services, food, are difficult at the best of times. And what the climate crisis does is make things worse. And that's what I call, that's why I've called this the climate crisis is in effect multiplier. It makes worse what already exists. And I'll talk a little more in a minute about water as an example. This is an old WHO slide on climate change. It doesn't matter where you live, small islands, coastal town, big cities, rural villages, you are going to be impacted by the change in the climate. And of course, it affects all of the things that we require and rely on for sustenance, on food, on air, on water. So it's a material, certainly in the case of the Pacific Islands, a material impact on food, water, air, and indeed the environments in which people live. Here in the Pacific Islands, great majority of people live on the coast, on small islands. If you take out Papua New Guinea, more than half the people live within a kilometer of the coast, and 90% live within 5 kilometers of the coast. So Pacific people, they exist on small islands, but even within those islands, they live mainly around the coast, with the exception, of course, of Papua New Guinea. A very vulnerable region. Every year, the World Risk Report puts Vanuatu as on top of the list, and more often than not, 6 of the top 15 most at-risk nations in the world from the Pacific: Papua New Guinea, Fiji, Solomons, Vanuatu, and Tonga. From high risks from floods, tropical cyclones is familiar to many people, but obviously earthquakes and tsunamis. So it's a fragile region, and it's a very vulnerable region. When we talk about climate change, this is what people have a mental picture of, dramatic scenes of floods or cyclones. But I want to just remind us all that the real issue for many in the islands is less dramatic less visible, and ocean acidification is a key one. Ocean acidification, seawater temperature rise leads to coral bleaching. And coral bleaching, as we all know, kills coral, which is an essential part of the food chain. And you will recall me saying earlier that 80% of the protein source for Pacific Island people come from the sea. So you can imagine quite quickly, when you have coral being threatened, you are in effect threatening the major food source for these populations. Much has been made about sea level rise, and certainly it's captured in the media that some islands are going to disappear under the water. That's rather dramatic, but the reality is that the sea level rise, of course, will be uneven, and at its peak in some places about a meter. So the idea that islands will disappear under the sea is, as I say, rather dramatic. But other aspects of the climate crisis are much, much more important, such as ocean acidification. No doubt, of course, that severe weather events is a big part of our lives in the small islands of the Pacific from November through to about April in relation to tropical cyclones. Major costs in recent times, every year there's 2 or 3 cyclones. In 2015, tropical cyclone Pam, a category 5, went through Vanuatu and really damaged, set back about 2/3 of the GDP in that country. And of course, you'll understand that this will take a while for them to bounce back. When they do bounce back, another cyclone comes along. And Fiji is a classic illustration of this. Their main problem at the moment, of course, is trying to cope with COVID-19. The impact of climate crisis is broad and wide-ranging: food security, saltwater intrusion and droughts affecting water security, loss of land, biodiversity loss, and of course, the health issues as a result of rising temperatures and weather changes. As I mentioned earlier on, the climate crisis affects the entire determinants of health, the food we eat, the water we drink, the weather we experience. And as I signaled earlier on, certainly in our part of the world, I regard the climate change, climate crisis as an effect multiplier. It aggravates existing health risks. For example, post-disaster disease outbreaks usually from pre-existing threats, and aggravates access to pre-existing gaps in access to water and sanitation. And the reason I say this is that preparedness is critical. In other words, the sooner people prepare and anticipate what might come down the line, the better. So preparedness is an integral part of small island states responding to the climate crisis. I signaled earlier on, I want to talk about sanitation, but water, if you, on the right, access to clean water, this is comparing Oceania, the small island states, with the rest of the world. As you can see, safely managed clean water elsewhere in the world is improving from 2000 to 2017. These are UNICEF figures, by the way. But the situation in the islands is not that great. And if anything, it looks as if it's going backwards. And so, as I say, access to clean water, what climate crisis does is aggravates and compromises access to clean water in small island states. And you will recall, access to clean water at the best of time is difficult on coral atolls and small outer islands. This is an example of what I mean by the climate crisis making worse what already exists. the main problem is in Melanesia. On the right-hand side of this graph, these are all the various islands of the Pacific. Polynesia, Micronesia, generally better, but access to clean water in mainly Melanesia is problematic. Sorry, this is a water supply graph now. This is another way of looking at the impact of the climate crisis on people and their livelihoods. Higher air and sea temperatures affecting livelihood, wetter seasons and drier seasons affecting agriculture. So in some places of the Pacific, while there's too much water, it's a common feature in the Northern Pacific, the Republic of the Marshall Islands, Federated States of Micronesia. They generally have trouble with access to water and experience droughts on a regular basis. So one of the main issues, of course, with the climate crisis is compromise on food security, and the prediction is that coastal fisheries harvest would decline by about half by 2100 due to overfishing, pollution, ocean acidification, and indirect effects on habitats. And the pelagic fish species are expected to move further east with higher catches in Polynesia. Sea level rise will have direct effects on low-lying atolls through loss of land, erosion, saltwater intrusion. And I've spoken quite a bit already on ocean acidification. One of the big impacts, of course, is extension or expansion of areas where our vector-borne diseases exist. Dengue, chick, the main ones. Or dengue in our region is the main one, and the expectation, of course, is that with warming, that there will further greater risk of spread of vector-borne diseases in our region. It used to be that we had one strain of dengue circulating in the region, but at more recent times, all 4 strains have been circulating in addition to Zika and chick. This is some figures from friends and colleagues at the Pacific community. This is a slide I've borrowed from someone. Betio is in the Republic of Kiribati, and this is a picture of the maternity ward, obviously, in the Tarawa, and as you can see, it doesn't look like a particularly safe or welcoming scene when mothers are about to have their babies. This is a rather dramatic picture of the effect of sea level rise, and this is from the Republic of Kiribati. WHO has worked with the small island states to produce information and guidance on what small island states need to do. There was a conference in Fiji, in Nandi, in 2018, and a report is available, and a number of policy guidelines, I suppose you could say, are now available. Obviously, there are other organizations involved in supporting small island states to respond to the climate crisis, including regional organizations such as the Pacific Community, the SPREP, the Secretary of the Regional Environmental Program. So there are existing organizations that help small island states respond to the climate crisis. So let me just finish by saying that the climate crisis is the critical existential threat to Pacific communities, without a doubt. they have minuscule contributions to the greenhouse gas, but most severely impacted by the negative impacts of climate change, climate crisis. The climate crisis, of course, affects access to food, to water, air, and where people live. It is, in effect, a multiplier, and effective action is urgently needed. I still regard the Paris Agreement as the unifying global instrument that hopefully people sign up and support, and it's encouraging that the United States have re-engaged. And I do think that the Paris Agreement is the instrument that unites us all. So, Wandini and colleagues, thanks very much. It's a rather quick run through of the situation from the Pacific Islands. So thank you very much.
Thank you so much, Colin, for this great presentation. So we can run through the chat. We only have one question from the chat at the moment, which is from Han Wen Chang, who asks, did you observe any migration away from coastal areas due to climate change in the Pacific Islands?
Yeah, so Fiji, thank you for the question, Han Wen. And I know that a colleague, Ely, is online here. Fiji, the last I heard, they were looking to move 63 villages away from the coast. The Pacific community has been involved helping the Fiji government and the people move at least 3 villages that I'm aware of away from the coast. And Fiji is just one example of the situation in the Pacific Islands, because other small island states are looking to move their people away from the coast as a result of the climate crisis. So yes, the short answer is yes. There was a time when particularly people in Kiribati and Tuvalu were looking for land and looking for opportunities to move their people if things get difficult, of course. But now I think most of them want the rest of the world to start to address the issues of the climate crisis so people don't have to leave their homes. You will understand that leaving behind your village, your home, your communities that your family have lived in forever is a major, major issue, and people don't want to do that if they don't have to. So, what do you do with your dead that are buried, for example? So migration is not the first option for people, but it is one that people have considered, obviously, as a last resort.
Yes, thank you so much for your answer. We have another question in the chat from Helena, who asks, does tourism have some impact in coastal areas? How do we make it sustainable?
Yes, for many in the islands, tourism is the big issue. There are two things. One is tourism, the other is tuna. The Pacific Islands, the Central Western Pacific, supply about 2/3 of the global supply of tuna. So when you're having your tuna sandwich in Munich, there's a two-thirds chance that it's come from the Pacific. But tourism, of course, is the other big one. In the Cook Islands, tourism makes up 80% of their economic activity. So as you can imagine, it's a big issue. And it's a double-edged sword, meaning it is, of course, a source of income and revenue for people and the governments of the region. Fiji tourism is a big, big issue. It does have its downside with pollution, with access, compromised, access to water and sanitation. So it is a major part of life in the small islands of the Pacific. Is it sustainable? That's a big question now being asked in the Cook Islands, whether they start again. I'm told that they have 130,000 tourists onto the small islands every year. And there are problems with disposal or waste management, with access to clean water and so on. So big question mark about sustainability. And as I say, the Cook Islands, if you're interested, you can Google the Cook Islands, because that's where concerns have been raised about the sustainability of tourism in the small islands of the Pacific. But tourism is a big deal in our part of the world, mostly okay in some of the other islands, but overdone in some places. Because the economic opportunities for small island states, as you would appreciate, is not, there isn't a lot of opportunities. It's either tourism or tuna and not much else. So a vexed challenge.
Thank you very much for your answer. We have one last question for you, which is somebody wants to ask if policies incentivizing the greatly affected third world countries by climate change from countries such as the US or China, which produce the highest carbon footprint, are actually present, or is this kind of policy even ethical, and should it be implemented? So yeah.
Well, that's what I said earlier on. Our smaller people on the small islands of the Pacific have been rather grumpy because they feel they're being severely impacted by the actions of other people, and other people should be stepping up and doing the right thing. But many observe countries to be not doing what they need to be doing. That's why I think myself and many others regard the Paris Agreement as the unifying document. If people can honor and step up and honor the commitments made in the Paris Agreement, it'll help us get there. It's obviously not enough, is my understanding. We're moving way fast beyond what is a sustainable level. So there is this underlying concern about the actions of the big polluters. And you'll recall a lot of the UNFCCC, the COP discussions, the small islands have been pushing for compensation. The polluter pay principle, if you like, which some of it has been incorporated in the agreements, but I suppose the view from the islands is the big polluters of the world are not carrying their weight. There's a particular unhappiness about Australia because in the small islands of the Pacific, they regard Australia and New Zealand as their big brothers that really ought to be looking out for their younger brothers and sisters. And Australia, as you know, hasn't really been doing their part, and people in the islands are very concerned about Australia's continued support for the coal industry. And so Australia has a rather mixed reputation in our part of the world. To be fair, though, Australia also funds many of the climate mitigation and adaptation activities in the small islands. So it is, again, a double-edged sword. New Zealand was in the same category as Australia, but New Zealand appears to be moving ahead with more appropriate measures to try to respond to the climate crisis. This is the big issue for the small islands of the region, really expecting the rest of the world to do the right thing, because they are the ones who are living already with the negative impacts of the climate crisis.
Thank you very much. We have some more questions coming up, but I think we only have time for one. Emily asks, how has climate change affected the national budgets of the Pacific Islands, especially around health?
I have to say that I'm disappointed with the response from the small island states around health. As far as I'm aware, Fiji is really the only small island state that has prepared a policy on health and a health plan for mitigating and responding to the climate crisis. Most of the other islands have been preoccupied, understandably, with the big issues of the climate crisis, trying to get their voices heard at the global level to try to get the big polluters to take action. But many of the small islands in our part of the world have not produced health plans in order to respond to the climate crisis. And this is the message that we've been giving out And colleagues from SPC, the Pacific Community, and WHO and SPREP and others have been helping the small island states to put in place health policies and health plans to respond to the climate crisis. But this is clearly, at least in our part of the world, an area where additional support is required and encouragement to get the governments of the small island states to make explicit preparations for health and health services. The picture I showed you is not my picture, by the way. I borrowed it from someone else, of the maternity unit in Kiribati. That's also an illustration that many of the healthcare facilities in the small island states are on the coast. And there's a lot of work to be done to climate-proof, future-proof, and move healthcare facilities away from the coast. The last thing you want in a cyclone or a flood is for your healthcare facility to be washed away or destroyed, which is the one exact facility that people most need in those times of crisis. So there's a lot of work to be done in health and the health sector in the small islands of the Pacific. And certainly we continue to encourage regional governments to take action on health. A lot of activity in the broader impacts of climate change, and I have to commend the political leaders of the small island states that they've really done a good job globally in communicating their concerns about the climate crisis, but they really need to take more action in health and the health sector, in my view. Thank you very much, Wandini. I think I've taken up too much time from my colleagues, but thank you very much for this opportunity.
Thank you so much for your presentation and for your contribution today, despite being, it being 1 a.m. in New Zealand right now. So we really appreciate that you're here today. And yeah, thank you very much. I think we can move on. We can move on to the next presenter, who is Dr. Renzo Guinto. Dr. Renzo is an associate professor of global public health and the inaugural director of the Planetary and Global Health Program of the St. Luke's Medical Center College of Medicine in the Philippines. He's also the chief planetary doctor of the PH Lab and has served as a consultant for various organizations such as the World Health Organization, the World Bank, USAID, and the International Organization for Migration, amongst others. Thank you so much, Dr. Guinto, for being here today, and you have the floor.
Thank you very much, Wandini, and of course to the organizers of this important convening. It's almost, it's 10 o'clock here in Manila, but of course I empathize with Professor Colin, who is, I think, a few hours ahead of Manila, and it's a tough act to follow because Professor Colin already laid out some of the major themes around climate and health in the context of islands and small islands in particular. First, of course, I forgot to also start my talk by saying, I would like to send my sympathies to, the German people for the extreme flooding and the casualties that have happened over the past several weeks. It just shows to us that whether you're a small island or a big Western nation, everyone is really affected and vulnerable to the impacts of climate change, and action is what we need now. So I'll be sharing a bit of lessons and perspectives from the Philippines, which, by the way, is not a small island. Okay? We're actually an archipelago of more than 7,000 islands. And I think what we can glean from this presentation is that the big island groups like the Philippines and the small islands in the Pacific and in the Caribbean and in Africa, all these island nations can actually learn from each other and come together to galvanize a strong climate advocacy, especially against the powerful, the big countries that unfortunately have emitted the greatest amount of greenhouse gases into the atmosphere. And then now we have these islands, big and small, bearing the brunt. And Just a second. And, because in my title, that the phrase planetary health is mentioned, I just want to introduce this term for those who are hearing it for the first time. Of course, we're all familiar with the term public health. Public health is really about the health of people. Over the past century, we've increased the life expectancy of the world by 25 to 30 years. And thanks to public health interventions. But unfortunately, we've made those achievements at the expense of the planet. We've been putting food on the table, and in the pursuit of global nutrition at the expense of natural ecosystems that we've turned into farmlands and other and produced food for our families and our communities. We've created cities that enhance socioeconomic opportunities, which are important for health creation, but again at the expense of the planet by polluting our air, water, and soil. And so planetary health is this convergence of the health of the people and the health of the planet. As a physician, I always say I now have two patients, people and planet, and I urge you to embrace this paradigm, this framework, this mantra. And I understand that I'm speaking in a One Health Cafe webinar seminar, and but planetary health is really what I would describe as a grand convergence of all these concepts: One Health, eco health, international health, global health, earth sciences. The social sciences are so critical in understanding and packing planetary health and problems and creating planetary health solutions, because at the end of the day, a lot of these environmental and health problems are created by social systems. And planetary health acknowledges that we really contributed to the mess that we're in. There's nothing to blame but us, because of as you can see, their anthropogenic change, human induced change, our consumption patterns, the demographic shifts that we're seeing, migration, urbanization, population growth, technological advancement. All of these have led to a wide range of changes in our ecosystems: biodiversity loss, resource scarcity, land use change, which are ultimately creating a wide range of health problems, the ones that you are seeing on the right. And our session now is about climate change, but I want to remind everyone, and this is, I think, the added value of the planetary health approach. Climate change is indeed, one, if not the defining challenge of our generation. But, there's also this concept called the planetary boundaries framework. And right now there are 9 planetary boundaries. These have been identified by the Stockholm Resilience Center. And climate change is one of the 9. One is only one of the 9. And unfortunately, 2 out of 9 have already been breached: biodiversity or biosphere integrity, and the natural biogeochemical flows of P and N, phosphorus and nitrogen, because of our addiction to artificial fertilizers in the agricultural sector. So 2 out of 9 already in red, already been violated. And 2 out of 9 are soon to be violated. The ones in yellow: land system change. We've been turning, every forest into golf course subdivision, city, and climate change, of course, which has already been discussed comprehensively by Professor Colin. And this is the reality now. These are the latest, projections. Given all the commitments of the countries right now, all the nationally determined contributions that the countries have submitted to the UN FCCC, we're on track to reach a world of, with a global average temperature increase of around 2.7 to 3.1 degrees Celsius. That's like more than a degree Celsius higher than what the Paris Agreement laid out, which is 1.5 to 2 degrees Celsius increase, by 2030. And so, these are really alarming, situation. We need to really push our countries to make much more ambitious commitments so that we are able to reach the goals of the Paris Agreement. So I will not belabor you with the details of this graph because Professor Colin already talked about the myriad health impacts of climate change. I think the summary is that one, climate change affects health in multiple ways. There are multiple pathways as you can see. And number two, there's really no single disease group that is immune to climate change. Infectious diseases, non-communicable diseases, nutritional outcomes, and much more recently, there's also growing evidence of the impacts of climate change on mental health. And I have a slide on that in a short while. And I think this also echoes what Professor Colin has already emphasized. You know, the health impacts of climate change are unfairly distributed. This is a classic, slide from the WHO, still yet to be updated, but I think still rings true until today. At the top map, you will see the parts of the world that have emitted the greatest amount of greenhouse gases to the atmosphere. And at the bottom, you will see the parts of the world that are going to bear the brunt and suffer the consequences of climate change, especially the health consequences. And as you can see at the bottom, which parts of the world will be affected very much by climate change? It's Africa, it's a large parts of South Asia. And I always say that the Pacific Islands are too small to be magnified in this map, if not, erased from the face of the earth if sea level rise continues to worsen. Although Professor Colin said a while ago that these images of islands totally disappearing may be exaggerated, but still, the inundation brought about by sea level rise is something that we need to address. So this is my country, the Philippines, a country that is so rich in, biodiversity, both terrestrial and marine. The Philippines was once called the center of marine biodiversity. And all of these ecosystems, including its peoples, are definitely, facing, the huge threat of climate change. And in the next slides, I will just show to you a brief survey of these health impacts in particular that the Filipino people are expected to, experience in a world of unstable climate. And yes, we're at the center of biodiversity. We're also at the heart of planetary health, as I always say, not just because PH is referring to both Philippines and planetary health, but the Philippines is really, one of the parts of the world that will, again, suffer the consequences of climate change and planetary damage. Here in this map, this is Southeast Asia, the region where the Philippines is located. It's actually on the top of Australia and New Zealand and on the left of the Pacific Islands. And in this map, you will see that the redder the country is, the more vulnerable the country is to climate change and its myriad consequences. And unfortunately, the reddest of them all is my beloved Philippines. And so, as I've said, the Philippines is really at the heart of the climate crisis. And so what happens when these climate-related extreme weather events such as typhoons and intense flooding do occur? As you can see in this picture, this was taken in 2013 when Typhoon Haiyan hit the Philippines in 2013, the strongest typhoon to ever hit land in human history. Infrastructure, livelihood, agricultural systems, hospitals and health systems are also destroyed. And people, of course, are affected. Around 7,000 deaths were incurred, and more than hundreds of thousands have been affected by this calamity. And even during the time of COVID, the Philippines was not immune to climate change and its disastrous effects. Here you will see that during the time of pandemic, Filipinos, especially the poor and the marginalized, were faced with a dilemma. On one hand, do I stay in the house, protect myself from the unseen coronavirus? Perhaps my house will be inundated by the strong flooding and the roof might be blown away by the intense wind. On the other, I can move to the cramped evacuation center, these temporary shelters, safe from climate change, but highly susceptible to getting the coronavirus because, as you can see in the picture, there's no social distancing to begin with in these temporary shelters. So indeed, these extreme weather events related to climate change, they're the worst disaster to hit PH. And PH, as I've said, stands for the Philippines, for the people's health, and of course, for planetary health. Another major impact of climate change in places like the Philippines is sea level rise, which I already mentioned a while ago. The Philippines has one of the longest coastlines in the world, and many coastal communities are certainly at risk of sea level rise. And we know when the level of the sea rises, seawater intrudes into, for instance, freshwater systems. And there's a growing body of work, albeit not in the Philippines, but in other places. We're just starting to really explore how sea level rise can actually lead to the increasing salinity of drinking water, which can then lead to a wide range of health outcomes. Hypertension, preeclampsia among pregnant mothers, infant and neonatal mortality, kidney disorders, etc. So this is one growing, for the longest time, it has been a neglected area, but a growing area in public health and climate change. And of course, it's not just your water that gets salinized. Your entire cities and communities can get inundated, and people will need to be forcibly displaced. And for instance, the capital city of Manila is being projected to be underwater by 2050 if climate change is not averted. And so, again, we need to mitigate climate change, but also because of the slow pace of action in terms of climate mitigation, cities like Manila and many other coastal communities in the Philippines will need to start thinking of long-term adaptation measures so that people can still thrive, in places like, where the level of the sea is rising. Of course, a while ago, Professor Colin already mentioned that climate change is going to worsen and exacerbate infectious diseases like mosquito-borne diseases, waterborne diseases, foodborne diseases, all of which are climate sensitive. And this is another growing area of work in places like the Philippines, where we have dengue and malaria and all these other mosquito-borne diseases endemic in the country. Of course, a while ago I showed to you the quote unquote wet impacts of climate change. Of course, there's also the dry or the hot impact. And in the Philippines, we're already seeing our heat indices rising each year, and that will require public health adaptation measures that will address, for instance, heat-related illness. And other heat stroke and other forms of stress that is brought about by again rising temperature. So again, this is another area that needs to be worked on still in the Philippines. And of course, it's not just people getting exposed to intense heat, but also our farmlands. And increasing temperature, droughts, they will certainly endanger the ability of our, our farmlands to produce food for our population. And so food security, for sure, as already mentioned in a while ago by Professor Colin, it's an issue in many small island developing states. It's also an issue for places like the Philippines, which is still very reliant on agriculture, also for its economy. And because we are, a group of islands, and we get our food not just from the soil, but also from the sea. And so when we think about food security, we have to come up with approaches not only for our terrestrial food systems, but also for our marine food systems. And, Professor Colin also mentioned a while ago coral bleaching, which is an impact of climate change as a result of, the warming of the sea. And this is something that the Philippines is also experiencing now. And so, we can anticipate that in the years to come, if we don't avert climate change and coral reefs are continue to be affected, and there will be reduced habitat for fish to grow, then we can anticipate, even protein deficiency in coastlines where people are reliant on the marine environment for their food. A while ago, I mentioned the growing science of climate change and mental health. And climate change is going to affect, the health of our brains and hearts in two major ways. One is through the abrupt and sudden and catastrophic extreme weather events. There's a typhoon or flooding that happens. People get displaced. Children are traumatized. And these events can lead to short-term or even long-term mental health sequelae. On the other hand, and this is a growing science, we're starting to also investigate into this. Climate change is, as we know, will be producing a lot of slow onset phenomena or events, increasing temperature, sea level rise, and all of these will also impact the mental health of communities. There's a growing interest in concepts like eco-anxiety or climate grief. And while these are, better studied, for instance, in Western contexts, we are starting to investigate it also in developing country and even in Asian contexts in terms of, how climate change is affecting mental health and what are the adaptation and coping strategies that are context specific. So this is just an example of, the resilience of the Filipino people. A natural, an extreme weather event happens the day before and the day after. People are, coming together, praying, and we're interested in how to really enhance even the psychological resilience of our people as we anticipate more extreme weather events to occur in the years and decades to come. So now I'm moving to the last part of my talk. And, I guess, we've been talking a lot about the problems and the negative impact. So perhaps we can have some, some ideas regarding the solutions. Are we ready to build health systems that consider the climate? And I'll just show to you very quickly some slides. And these are just some of my previous and ongoing work in terms of working with communities, with municipalities to really enhance their adaptive capacity to climate change and its health consequences. And I think in the 21st century, our health systems in the era of planetary health should be, universal, meaning everyone has access to it, and it should be high value. People should be, leaving the health facility not sicker but healthier, but also happier because they're satisfied with the healthcare that they receive. But I think we need to add additional considerations, one of which is we need our health systems to be climate smart. And climate smart is this convergence between mitigation and adaptation. We need to make sure that our health facilities and hospitals are the last building standing, that we are equipped to address to the climate-related health consequences, whether the slow onset ones or the abrupt sudden ones. And then, of course, we cannot ignore the fact that we are still in the middle of a pandemic, and we need our health systems to also be pandemic resistant again in the years and decades to come. So more frameworks to show to you how local health systems can actually help in adaptation, but also mitigation. And we need to make sure that our health systems are able to address not just, the improvement of health outcomes, but also in the assurance of, the continuation and the steady provision of health services and other healthcare commodities. And of course, we need the health systems to be also addressing the broader determinants of health. A while ago, Professor Colin mentioned that we really cannot ignore the social determinants of health that are also interacting with climate change and other forms of vulnerability. There's this other conceptual framework or operational framework developed by the WHO. I would like to invite you to, Google this. An operational framework for climate resilient health systems, how you can incorporate climate change into the different building blocks of the health system. So I'll not go into detail, but if you have questions, please let me know later. And the WHO also last year released a guidance on how to build climate resilient and environmentally sustainable healthcare facilities. So we can incorporate climate change considerations, not only at the national health system level, at the level of governance and policy and planning and financing, but also at the level of the facility. Again, we want to make sure that health facilities, bend but do not break when climate related, extreme weather events, for instance, do occur. And when we talk about building the adaptive capacity of health systems to climate change, we can't just think about, the medicines and the infrastructure, which are the more material components, what I would call the hardware of health systems. We also need to think about the software of health systems, leadership from the top, the collective intelligence of people and the social capital, the spirit of innovation, and what are the values that underpin the community and their work. So it's really a mixture of hardware and software elements, if we really want to enhance the adaptive capacity of local communities to climate change and its health consequences. And I already talked about universality of healthcare or universal healthcare, and UHC and climate action are what I would call sister agendas. We need to achieve universal healthcare because it will be an important component in our societal adaptation strategy to climate change. But we also need to act on climate change so that we, reduce the burden of climate change on universal healthcare systems, because as we know, climate change is going to generate a wide range of health impacts. And overall, if we do climate action and universal healthcare together, we can definitely improve health and health equity for all peoples. And also, while I emphasize about the need for adaptation and resilience of the health sector, we also need to still think about our own carbon footprint. Around 4.4% of the global emissions are attributable to the health sector. And so a few months ago, I had the privilege of co-authoring this report, which is a global roadmap for decarbonizing the health sector. As you can see, there are many ways that we can decarbonize our health sector, shifting to renewable energy, investing in zero emissions buildings, providing healthy food and sustainably grown food, etc., which will also help us reap a wide range of health co-benefits. So I would like to conclude by saying we need to come together, bring together different disciplines, different peoples from different countries and from different generations. And in the Philippines, we started this network, Planetary Health Philippines, to really act on these myriad challenges. And I hope, well, I'm aware that our German friends have already come together to build your planetary health network. And so it will be great if we can have more collaboration between Germany and the Philippines in enhancing our, again, collective climate resilience. And at the end of the day, we need to make sure that, it's the frontliners, the communities that are at the heart of our work. We can do the policy work, we can do all the top-down investments, but at the end of the day, it's these communities that are facing the impacts of climate change firsthand that will, need to be supported, their capacity to be built. So, to conclude, I'm sure all of you are very familiar with the mantra, flattening the curve of COVID-19. We also need to flatten our curve, the curve of our carbon emissions and our ecological footprint. But the major difference between the COVID curve and the climate curve is that you can add more beds, recruit more nurses, and roll out more vaccines to enhance the healthcare system's capacity. But you cannot do anything with the Earth system's capacity because that is constant, unchangeable, and non-negotiable. So the only curve that we can really change is our curve, our ecological curve, our ecological footprint. Because if we don't get our acts together, we can anticipate not just future waves like what we're having now with COVID-19, but future tsunamis of climate-related health consequences. A lot of them we've already discussed a while ago. And, yes, the Filipino spirit is waterproof, as we always say here. But as climate change, worsens, I'm quite worried about the extent by which, the Filipino spirit can be, climate proof. And therefore, we need climate action now. And we owe it to these children that are already being carried in these containers, which are being protected from extreme flooding and typhoons. So we owe it to these children, and we owe it to the children that are yet to come. So together, let's advance the health of people and planet. Thank you for your time, and I look forward to our conversation.
Thank you so much, Dr. Guinto, for this great presentation and for this introduction to planetary health, which is a very important discipline. We have unfortunately run ran out a little bit of time, but there is one question which is quite interesting in the chat that I would like you maybe to answer. It's from Emily, who asks, do you think that the impact of eco-anxiety will impact national birth rates in small island states, given the impact of stress on maternal health during pregnancy? Do you think we will see an increase in neonatal births? And how will these associated costs affect the public health systems? That's something I haven't personally thought about. So
Right.
interesting question.
Right. So very interesting question. Thanks for that question. I think and it's more of, for people in the high income countries, there's, I think, growing evidence that especially the younger generation are now basically thinking twice whether they should give birth or produce new offspring because of all these things that we're hearing about the climate crisis, right? And in fact, I have a collaborator that is about to roll out a national survey in the US to ascertain that. I'm not sure if that is an issue for small island developing states. But I think, expanding the question to, just thinking about ecological anxiety or ecological or climate anger, I think what we need to also ask is how can we channel such anger and turn that into, kind of positive action for climate change. So, I've heard from some psychologists that there's also growing evidence that people who are angry about the climate crisis are able to cope by actually making some positive action, and I think we need to start investigating further in this, again, emerging space, and find ways to, again, channel our anger into some positive action. So I hope I was able to answer. It's a new science, but thanks for raising that.
Thank you for your answer. Okay, so let's move on to our last speaker, who is Mrs. Pamela Bapudandu. Mrs. Bapudandu is an environmental counselor by profession who joined the United Nations 25 years ago as a deputy program officer to the UN Institute for Training and Research. And for the last 22 years, she has been the national coordinator of the Global Environment Facility, GEF Small Grants Program, implemented by the UNDP in Mauritius. I'm very excited about your presentation today. And yeah, you have the floor.
Thank you, Wandini, and I'm trying to share my screen at the same time. Good afternoon, good evening. Can you see my screen?
Yes.
Yeah. Okay. Good afternoon, good evening, and good morning to some of you, because it's very early in some places. The thing about speaking last is that everyone else has already said whatever you want to say. But I'm very happy to be participating in this webinar, Wandini, and thank you so much. I told you that I'm impressed by the fact that doctors are interested in climate change, and I can also congratulate Renzo Guinto for his presentation. Really a very extremely useful presentation. I'll start by telling you a story, and I hope that no one will go to sleep. In fact, doesn't work when I want it, so let me share the PowerPoint presentation instead. Share screen. And that's no, stop sharing, share screen, and let me share this one. Okay, so a small story. Once upon a time, that's 5 to 10 million years ago, in our area of the Indian Ocean, you have this major impressive plumes of magma piercing the oceanic plate, and yeah, viscous molten lava released from the bed of the sea, and you have hissing vapors, water, sulfur, everything, basalt projections that are emerging from the seabed, and these will form a vast encroachment of several kilometers thick. And and pain from nature. This place, this land, if we can call it that way, at that time, it's bare at birth, and it's a basaltic mass, and therefore it has not been in contact with other lands and fauna and flora. And there will start an incredible adventure made of rains and erosion. We learned that from our geography sessions, which will form the layer of earth. Then a series of circumstances and hazards will bring life to that basaltic mass. And these will be through the wind, through the sea. We will have seeds, we will have insects, we will have spores of ferns, eggs of lizards, and so on, that will drift to that mass of land, and will start something which is called life on this island. These species that have traveled incredible distances, some of them coming as far from literature shows, science shows, from the Andaman Islands next to India, will start developing in unknown land, and they will start acquiring properties that for some of them are very specific, and the whole world knows about at least one of them. And it's a real survival war which begins, and only those species which are strong enough and vigorous enough will survive. That species, that specific bird that everyone knows around the world is the dodo, which will stand out because, well, it was so happy in this exuberant and prosperous nature that it grew out of proportion, and its wings narrowed until it couldn't fly. And of course, it had to pay the price for not flying. It is estimated that it takes around 30,000 years before a new variety becomes established in such land. And although the island at that time is swept away by cyclones and bad weather, it is that time when Mauritius and the Comoros and all those other islands were blessed. Men, and I insist on men because men were sailors, women could not be sailors at that time. Men landed in Mauritius in the 17th century. It was not called Mauritius at that time, of course, and discovered the rich and flourishing biodiversity made of giant turtles, bats, multicolored geckos, ebony trees, and so on and so forth, and many other species that, of course, man sees for the first time, and he will start coveting. Thus, what fire, air, wind, sea, and earth had created in an epic that lasted millions of years, man himself issued from a careful selection of nature, brings us back to Darwin, will destroy without regard in the space of a few short years. The dodo no longer existed by 1630. The giant tortoise last observed in 1795. Entire ebony forests destroyed to make boats, to make pianos, and so on. So the trials of this blessed land started and never ceased. You can see on my slide, Mauritius is today the third place in the list of countries whose biodiversity is the most threatened in the world. And by 1997, the forest land had shrunk to less than 1%, less than 2%, mostly 1%. So we are very happy in Mauritius to have lucky to have had development which came through sugarcane, tourism, textile industry, offshore services, cyber island, and so on, which brought tremendous economic and social success for this little island. But it also brought challenges, and those challenges were are still in terms of energy production, waste management for such a tiny island like 80 kilometers by 40 kilometers, and it's not the Philippines with 7,000 islands, water management, food security, and above all, what we've all have been speaking of until now, climate change. So my story ends here, and I will explain how through the GEF Small Grants Program, we have supported agriculture to help with health and to help with building resilience against climate change. Mauritius has a disaster risk profile which is very high, and we know that it is the second largest risk after cyclone is climate change, and the direct economic losses which are associated with these disasters. So it will, and it is hitting people's home. But it's not only climate change that is affecting us, it's also the compounding factors like rapid urbanization on former agricultural land, which has strained the national drainage system. And drainage system right now is cement ones, man-made ones, which take the whole flow of the water and drains it to the sea. So we lose the water that's coming in, but at the same time, it gets over flooded, and it's not something that is acceptable anymore because of flash floods and destruction of our housing and infrastructure and crops at the same time, bringing in diseases. Industrial agriculture in Mauritius, you can see the fields, the sugarcane fields. It has promoted monoculture in Mauritius, and it has reduced at the same time biodiversity, and it has changed the behavior of butterflies, of pathogens, of pests, and it has deteriorated soil biology and reduced climate resilience in the production. I want to make sure that we all understand that pesticide and chemicals are poisons, because there have been a lot of discussion in Mauritius and elsewhere to decide whether we link the excessive use of pesticide and chemicals to cancers, to symptoms like dizziness, nausea, neurological effects, and so on. And I want to ask you, if you have time, to read the latest report from Institut National de la Santé et de la Recherche Médicale. They just very recently, I think it was 30 June or 30th of June 2021. It's a collective expert review which shows indeed how pesticide use has impact on many diseases for children and adults, and they take a closer look at 6 adult diseases. I really would like to invite you to review this. It's not only about those who have occupational exposure to pesticides like the planters and so on, but it's also about school children whose school are very near crop fields like we have in Mauritius, and other people as well, and those who eat them. So what do we do at the UNDP GEF Small Grants Program? We just a very short slide on the Small Grants Program. It was established in 1992 at the Rio Conference on Sustainable Development. And the program provides up to $50,000 directly to local communities. We give money only to the civil society, but we partner with the private sector, and we partner with the government in terms of biodiversity conservation, climate change mitigation and adaptation, land degradation and sustainable forest management, international waters, and chemicals and waste. Our portfolio to date is 189 projects that we've supported for nearly $6.5 million US. And the pictures I'm showing in all my slides as from now are pictures from our projects. To decrease the agricultural chemicals and enhance resilience to climate change, what we've done is with our partners. And I'm happy to see that one of our partners is online today. It's the Fondation Ressources et Nature. We've pioneered sustainable agricultural practices over the last 26 years in Mauritius. And we've been very determined because we started with, a few people convinced like us that we should move to sustainable agriculture, but the major big planters did not want to move. So it's been a long, long road to success. Today, we can say that it is successful, and people are more and more talking about the need to build resilience to climate change through agriculture as well, through sustainable agriculture. And we started with simple composting, and then we pioneered organic farming, and then we moved to agricultural systems where we have ecosystem services such as agroforestry and agroecology. So here you can see detainees. We've worked with detainees on producing compost. We've worked with street children as well with producing compost, and many other farmers as well. But those detainees are at Petit Verger prison, for those of you who know Mauritius. And this is the largest composting facility in the island, where detainees and officers of the prison are taught how to make compost, and they sell it, and they earn the money back to their account. So when they go out of prison, they have a small amount of money which is already in their account and which they can use. And of course, they have acquired the skills to produce the compost. We also empowered in collaboration with Fondation Ressources et Nature, empowered retrenched low-income group of women, street children I mentioned, fishers in organic crops production, medicinal plants production. And we pioneered the first organic certifications by EcoCert. Actually, I contacted EcoCert, which is based in Germany, and they linked me up to EcoCert in Madagascar, and we worked with them in collaboration with Forena. We also contributed to the organic farming bill, which is to be proclaimed by the Ministry of Agro-Industry and Food Security. Some other projects are linked to integrated pest management. These are what I call my scientific crop growers. What they did was test lemon yellow grease traps for a pest which is called leaf miners. Leaf miner will attack your plant, and once it's attacked it, then it leaves open. It is open to other insects and other pests. So what they did was put the yellow, lemon yellow, it has to be lemon yellow, board in their fields. We supported them with 700 1 square meter such boards. They put grease on it, and this attracts the pest, and they get trapped and cannot go and affect the plants anymore. So through this very simple method, we decreased by 60% the use of pesticides in those fields. We also partnered with those who pollute and who sell pesticides. We wanted them to collect their waste pesticide containers, because waste pesticide containers end up in waste streams, in rivers, in the lagoon, and most of them get burned. For those of you who are familiar to our island, if you go around, you will see people, they have that habit of burning their waste, and many planters have this habit of burning waste pesticide containers, emanating very toxic fumes. So we worked with the pesticide producers and distributors actually to reduce those containers and put cages where farmers were taught to triple rinse their pesticide containers and put them in those cages, and those cages were inspected regularly, and the waste pesticide containers were used to manufacture plastic planks. The cage which you can see on your left are actually planks from those very waste pesticide containers. So it's called circular economy, and we've managed to target 1,000 farmers directly, and we've managed disposal of 20,000 triple rinsed empty pesticide containers. This has now been upscaled by the government, by the Ministry of Agro-Industry, and it's set up in 34 places, 34 sites where farmers can go and drop their waste pesticide containers. We've supported delivery of organic vegetables through development of distribution platforms, supported reduction in the use of chemicals through safe agriculture, and income generation for many people. So people in Mauritius nowadays can order, they can just place a call or use Facebook to order organic vegetables delivered to their place through support from our program. A few last slides to share what we've done with regard to climate change and the new mindset with regard to building resilience for farmers. What you can see in those pictures are crops that were affected after the heavy flooding, like cabbage and so on, the recent heavy flooding in April 2021. Farmers see their land considerably affected by the effects of climate change and flooding. However, it remains very hard to convince farmers to change their practices. And one strange thing that we've noted is that it's really surprising, but not much is done after flooding to build resilience against climate change. And local growers keep cultivating the same way as they did before. They will put their seeds again, and then all of a sudden, if there is a flooding, then they lose the seeds, they lose everything. So what we decided to do was train those farmers and tell them, you have to change your practices, and you have to change to simple practices like contour farming, which will reduce the amount of topsoil that is lost during floods and that are washed away during rains. In 2018, we brought Dr. George Felix, who is the guy showing his fingers in the middle. George came from Puerto Rico, and he's now a lecturer at University of Coventry. And George did a whole survey around Mauritius and trained our farmers in collaboration with Forena, trained our farmers on agroecology in an attempt in our latest attempt to increase farmers' resilience to climate change. One of the latest one is with the support of the private sector. We are introducing an innovative drainage system, which are called bioswales, and which will help to regenerate ecosystem services. So in this picture, the lady who is on your left and standing near the rocks is actually on the drain. It's not the conventional drain that you will see usually with a cement drain where the water will overflood and so on. It actually is a drain. It is called a bioswale. It is a mixture of it's a trench in the soil about 1 meter deep or 1.5 meter deep, and a mixture of big rocks, soil, smaller rocks, soil, and still smaller rocks until you reach the upper layer where you put mulch, and you actually grow trees on those drains. And once you grow trees on those drains, you can choose the type of trees that you grow where you invite butterflies, where you invite beneficial insects. And we took the planters, those you can see on the left on the road beside me. For those of you who know Mauritius, it's Medine Smart City. We took the growers with us to show them, because growers, farmers need to see to believe. So we took them to visit, to show them how it is done in a smart city, how we can have such drains in their own fields. And we are happy to see that they are very interested, and they are going to adopt this technology. Two last slides, I think. How do we attract a new generation of farmers through these type of projects? We all know that following COVID, there was a lot of interest from everyone around Mauritius to grow their own crops at home. But it will take more than box gardeners to move to the next generation of farmers. We have to innovate. We have to innovate while keeping our traditional practices. We can innovate with digital farming, but it will especially depend on new generation of farmers conversant with concepts like innovation and sustainability while keeping the traditional practices which are good and which save and respect our ecosystem services of our good and beneficial pests. That's it from me. I am from the GEF Small Grants Program, United Nations Development Program in Mauritius. You can follow us on Twitter and you can follow us on Facebook. And if you have any question for me, I would be very happy to respond to them. Thank you.
Thank you so much, Mrs. Bapudundu, for this great presentation and all the work that you're doing as part of the GEF Small Grants Program in Mauritius. We have a question in the chat, which is, how has civilian participation around these environmental projects increased in the last 5 years?
Well, I will go more than the last 5 years. We started like 26 years ago, and it was very difficult at the beginning to convince people. I remember that when we had, FAO Day, World Food Organization Day, we only had our small planters coming in and explaining about their organic seeds and so on. And most planters were not convinced. They were saying that this cannot be done in the country. And in the last 10 years, with the help of our partners and with help of the media as well, we've managed to convince people. And I will say one thing, it's only through NGOs, through civil society, that we can manage to change the mindset. Scientists and so on can work on major reports and so on. But if you have convinced a tiny group of people, they can move things. So civilian participation, Emily, has increased, and the pandemic has increased that level of consciousness. And I will also say that there is a positive impact to the Wakasho, MB Wakasho shipwreck that we had in the country last year, because all of a sudden there is a lot of environmental consciousness.
Thank you for your answer. And I agree, sometimes it takes a disaster for people to start acting and thinking about these big issues we've been facing for a long time. We have another question which says, a recent report has listed Mauritius as a country with one of the highest use of pesticides in the world. Concurrently, the country has a high prevalence of cancer. What is being done to raise awareness about this issue?
Thank you for this question. And we all know how the cancer is rapidly increasing in Mauritius, both for men and women and even children. I want to say that the government of Mauritius has a master plan on organic farming, and has a master plan on to support growers towards organic farming. The former Minister of Agro-Industry himself had members of his family who had issues with regard to cancer. And he indeed promoted and came up with this pesticide bill. This is how we contributed with this on this pesticide bill. I think that many people are aware, and even last week itself, the now Minister of Agro-Industry was saying how difficult it is to move farmers to use organic pesticide. They still need to be convinced that they can use organic pesticide. It is a very hard work. It takes people to go in the fields. For one of our projects, we had 1,700, more than 1,700 visits to planters and growers, individual visits, talk to them and tell them, stop burning your pesticide containers in the field. So it takes a lot of hard work. So we are raising awareness on this issue, and I think the government is committed, but it takes a lot to change the mindset of old farmers, unfortunately.
Thank you so much for this answer. And as you've said, you know, real changes start at a local level, but I also believe that doctors have a responsibility, and other healthcare professionals in Mauritius have a responsibility to not only get involved in climate discussions, but also inform the patients, their patients about the impacts of pesticides or other climate change related problems on health. And I think this sometimes lack of interconnectedness between different parts of society can not play against a real change. And I think we need to start communicating a little bit more, and different parts of society need to work together to increase climate resilience in small islands. Okay.
Yeah, can I just say something,
Yeah.
Wandini? You are very right. We have to mainstream climate change and these issues in everything. And I really want to thank you because you are doing such a great job of raising awareness in your own way as well. So kudos to you, hats off.
Thank you so much. Okay, so unfortunately we've run out of time. I wish we could continue a little bit more, because this is actually quite interesting, and perhaps we could turn this into a series and continue our discussions. But I think it's time for us to wrap up. I would like to thank all the speakers who were here today and who contributed so much to this webinar. Despite the huge time differences between all of you, we managed to make it work, and I'm very grateful for that. I'd like to thank the Center for International Health and the One Health Knowledge Cafe for organizing, or helping me organize this webinar, which was a personal project of mine and which wouldn't have happened without their help. And thank you to all the participants who were here today. If you have any questions, feel free to contact me. My email is here, and you've also received plenty of emails from me already, so you have it. And if you want to learn more about the activities of the Center for International Health, visit our website. And yeah, thank you very much for being here. And I'll hopefully see you soon. Bye.
Thank you. Bye-bye.
Thank you. Bye.